Hi, and welcome back. Well, it's the fall season, and viruses are all around us, especially viruses like RSV. So that's what we're going to talk about in today's video. What is RSV? What are the signs and symptoms? Why do infants get hospitalized? And what are some things that we can do to prevent that? Now, RSV is a virus. This virus can cause common cold symptoms such as cough, congestion, runny nose, fever, but along with that, it gets a little bit worse with mucus, and more mucus. And this mucus usually peaks around day 3 of illness. And for our little infants, this can be a lot of work. That mucus can clog those tiny little airways. And when it does so, it makes it hard to breathe. And so you might see things like faster breathing. You might see retractions. That's when their ribs come in every time they breathe. They might tug at their throat a little bit more, have some nasal flaring. All this mucus may also cause them so that they pause during their feeds so that they can catch their breath. Now, it is because of all this mucus that sometimes our infants get hospitalized. And that's why it's so common to hear about it in the news and why people are so worried about it. If your infant gets hospitalized, it's usually because they're struggling with breathing or they're not staying hydrated enough because they can't breathe. And so treatment in the hospital is usually focused on that. They'll provide some oxygen, which will help the baby breathe a little bit better. They'll also provide frequent suctioning to help get that mucus out so the baby can breathe. And then if your baby's not feeding, they may need an IV line just to help with some of those fluids. Now, after all of this is done, your baby can go home once they're breathing well, on room air, and they're feeding well. Now, there isn't a cure for RSV, but there are some things that we can do to help them so that they feel more comfortable. One, deal with the mucus. That can include using nasal saline to help thin out the mucus, having a humidifier on at night to again help thin that mucus and make it more bearable. And it includes making sure that they're staying hydrated. Now, if you're ever worried about any of these things, especially if you're seeing some of those retractions like we talked about, that's a good time to see your doctor or go into the ER and get evaluated. Now, because mucus control is so important, let me show you a little demonstration. What you'll need for this demonstration is you'll need some nasal saline. I only need some sort of suction device. Now, I start out with the nasal saline whenever I do this because it helps to penetrate that mucus, thin it up just a little bit, and make it easier to come out. With the suction device, the main thing that you want to do here with this is that you want to aim for the back of the head. Aiming upwards isn't going to relieve as much of that mucus as aiming towards the back of the head does. And then that's it. Something simple can be very, very effective in helping your baby deal with the mucus of RSV. Now, we're lucky in the day that we live. There are actually 2 ways that we can help prevent RSV. We've got a vaccine that pregnant mothers can get. They get it during their pregnancy, their body builds up antibodies, and then that gets passed on to the infant before they are born. Now, if they're already born, no worries. We do have a vaccine that we can give, but it's more of an injection of antibodies. And these antibodies are given to the baby, and that provides the immediate coverage that should last throughout the RSV season. Other ways to prevent RSV: do what you normally would to prevent the spread of a cold. So wash your hands. Wipe down any dirty surfaces and toys. Don't share your utensils or cups. And if there are sick relatives that want to come over, it's okay to ask them to stay away for a couple days as their sickness gets better. So, to wrap up, RSV is common. We see it mainly as a common cold, but for our infants, it can cause a lot of mucus. Treatment includes mucus control, nasal saline, humidifier, anything that can help to reduce that mucus load and help the baby breathe better. And then, of course, do all those preventive measures to help your baby stay healthy. Well, that's it for now. Stay healthy, and I'll see you next time.